Hi, my name is Lauren Eirk, and I'd like to welcome you to Fitness Integrated Science TV. In today's video, I want to show you my top 3 exercises to help with meniscal injuries at the knee. The meniscus itself is actually an area of the knee that sits underneath the femur and on top of the tibia, the upper and lower leg bone. This region of the body actually creates a shock absorbency of the weight of the body coming over the top of it and the pressure of the floor going up through the base of the foot. The meniscus actually fills up that joint space, much like if you were to take a caulking gun and try to fill in that space. In the end, we have what's called horns, two circles, two meniscus. It looks something like the infinity symbol. The medial meniscus, which is on the inside of the knee, is usually the area that people injure the most just because that part of the knee, that chunky condyle, is actually so much larger. The lateral meniscus can also get torn sometimes from blunt force trauma or just from twisting in specific ways. When we have a meniscal tear, it doesn't feel good, particularly in standing. You may even notice as you walk around, there's a little bit of a clicking where the meniscus is actually getting caught in between that joint space. Many times in a surgical situation, they have to clip away part of that meniscus to help you feel better and actually to be able to straighten your knee. I know for myself, with one of my injuries, I actually couldn't straighten my knee, so I had no choice but to go and have that operated on. If you've had a meniscectomy, you may notice over the years that you have arthritic conditions developing, which brings us to what we're going to be doing today, which is actually strengthening muscles around the hip, around the knee, and around the foot. Now, I'm going to be using body weight only in these exercises, and I am going to use a towel for one of the things just to sort of show you how to give yourself a little bit of support. I want to begin with actually working on the muscles in the knee itself. So I'm going to begin from a seated position. Now, if this doesn't feel good, you can absolutely prop yourself up with a couple of cushions or blankets. You can even lean back. Now I'm just going to bend one of my knees so that I get it out of the way, and I'm going to look down and notice this knee. Right now I'm really trying to focus just on this joint by itself. From here I want to turn the kneecap to where it's facing the ceiling, so I'm orienting my hip. I want you to press the back of your leg down into the ground, and when you do, I want you to feel the condyles on the inside and the outside of that knee pressing down. You're going to notice that quadricep muscle actually becoming much more strong and changing shape, almost like a teardrop on either side. Hold that for just a few seconds and then exhale back down. Now that's called an isometric. Let's try that again. Squeeze the back of the knee down and then really tighten those muscles around the thigh. When you do an isometric, you don't want to shake or quiver. This should be very, very light. Just trying to squeeze that muscle gently and release it. When you're doing an isometric, you don't want to push super hard. We're trying to re-educate this muscle on how to contract again. Let's do that one more time, just squeezing into that muscle nice and tight and hold it. And then exhale. Now as we change sides, I want you to notice something. This one of my knees doesn't really move into the floor as well. So what I'm going to do is I'm going to take a towel and place it right behind that knee. Now I actually have contact. So I can press both the inside and the outside of the knee down into the towel. I would definitely work both sides, not just the injured side. It doesn't really take that much more time, and we have to always allow for that bilateral transfer. Go ahead and release, and let's do that again. We're pressing the back of the knee down into that towel or into the floor and squeezing. It's not so much about joint motion, but really about squeezing the muscles and then release it. So I like to think, how can I squeeze my quadricep muscles enough to elicit full knee extension? That's what you want to focus on. So let's just hold that there nice and easy, squeezing tight, and release it. I'm holding that anywhere from 5 to 10 seconds. No shaking or quivering. One more time to hold it. And release it. Now as we start to lower down the floor, this is the second part of my first exercise, I'm going to go back into my flex knee. From here, pointing the toe and knee straight up to the ceiling, I want you to go ahead and work on squeezing the back of the knee into the floor, but now I'm going to incorporate a little bit of ankle motion. Draw the top of your foot towards your shin. That's going to be ankle dorsiflexion. Hold that there for just a moment, and then exhale, relax. And when you relax, everything should return to normal. Let's do that again. Squeezing the belly of the quad, pressing the back of the knee down. Gently draw the top of your foot back towards your shin to hold it there. And release it. And this is going to be that final one. Squeezing into that quadricep muscle, tightening around the knee, draw the top of the foot back to hold it, and release it. Now as we bend that knee, let's go ahead and change sides. Pressing the back of the knee down again, squeeze and tighten the top of the thigh, draw the top of the foot back to hold it for 5, 4, 3, 2, and 1. Relax. And do that again, tightening into the top of that thigh to hold, draw the top of the foot back towards the shin, squeeze for 4, 3, 2, 1, and down. Trying to re-educate that muscle to fire, to contract again. Let's do that again. Whenever we have an injury, our body almost automatically makes our muscles go weak, our pain go up, and our tightness and compensation go up. So isometrics can help to unravel a lot of that stuff by drawing a certain sense of stability to the body. All right, so when that's done now, let's move back into some hip exercises. Go ahead and straighten that forward knee, but this time I want you to externally rotate from the hip. As you inhale, notice how far you're able to raise the leg without bending your knee. Now, if you're down here, you may even need to put something under your leg to support it so that you're not lifting the entire weight of your leg. If you're all the way up here, because you no longer have the influence of gravity, you're going to have to place your hands on the front of your leg. Just touch. Move your leg back into your hands, or if you're here, maybe just the force of gravity, just tighten. Now, if you're sitting your leg on top of a chair, just barely lift your leg up and lower that all the way down. Let's do that one more time. Externally rotate from the hip, move that leg into as much hip flexion as possible, but don't let your knee bend. Place your hand in the front and then just lightly move your leg back into your hand to hold it there, trying to focus your energies here and lower that down. All right, now let's turn the hip inward. As we turn the hip inward, keep the hips down, let's go ahead and raise that up. And you may notice that you don't have as much range with your hip turned in as you did with your hip turned out. Once again, lightly moving your leg back into your hands, no shaking or quivering, and release that back down. Rest for a moment. Then, keeping that hip turned in, let's try it one more time. Placing your hands in front, lightly moving your leg back into your hand for 5, 4, 3, 2, and 1. If you notice any kind of trembling whatsoever, back off of your force or back out of your position. Now, turn your knee and toe straight to the center. Move your leg right back up again. Place your hand in the front of your thigh. Pull your thigh back into your hand gently, just barely touching, working on squeezing that hip flexor region. And then exhale, keeping that knee straight, very important. Last one, inhale. Let's go ahead and bring that leg back in. Move your leg back into your hand to hold it there. And release it. So let's change sides now. As we bend that other knee, go ahead and straighten the other side. Turn the hip outward. So when we're doing this, the hips stay against the floor. Pick up your leg. And again, prop your leg up if you need it or hold it here if you can. If you're holding it there and you're cramping and shivering, you're not really using what I need you to use. We're trying to really get that muscle spindle activity, sensitivity to go up. We're trying to get the muscle to be sensitive to generating force again. And then as we exhale, we tighten into the abdomen and then lower that back down. Rest for a moment. Do that again. And again, as I reiterate, after an injury, we lose our sensitivity. We lose our ability to generate force. The muscle spindle activity is not as sensitive, and what we may notice is a lot of tightening all around that. So we're trying to get that a little bit more comfortable. Now let's turn that hip inward again from the hip. The toe and the knee are going to point in as well. Move that leg up as far as you can. Place your hands on the front of your leg. Move your leg back into your hand. Or again, feel free to use gravity. As I'm squeezing here, I'm also trying to maintain full knee extension. Your foot can be relaxed or in a light amount of dorsiflexion. And then exhale, lower that all the way back down, rest. And one more time, rotating that in. Let's move that leg straight up and then bring your leg back into your hand to hold it. Breathing. Great, then as we exhale, lower down. Now turning your foot right back into the center again, move that leg straight up to the ceiling. Hands on the front of your leg. Move your leg back into your hands and hold. Feel in those hip flexor muscles. And exhale, lower that down. Rest for a moment. And last time, as we bring that leg right back up, move your leg back into your hand to hold it. Squeezing for 5, 6, 7, 8, and let that go. All right. For my next exercise, I want to work on the hamstring. So what I'm going to do now, I'm actually going to place my feet, bare feet, against this sticky mat. This could also be done on a floor. Straighten one of your legs. Then I want you to just start to bend your knee as far as you can go without discomfort. Now look at my knee. It's pointing straight up to the ceiling. Turn your foot outward, but don't let your knee turn outward. From there now, very lightly press your heel down into the mat, very lightly, and imagine you're trying to draw the heel back towards your hip. Now in this position, I want you to focus on the belly of the hamstring on the outside of the knee. Holding gently and relax it. So do that again. I'm turning my foot out to start here. Then I want to come up into that ankle dorsiflex position. From there, draw the heel down and pull back. Easy for 5, 6, 7, 8, and relax. One more time, turning it out. Let's pull the top of that foot back. Gently draw the heel down and pull back. And you have to be really mindful. Isometrics take time. Most of the time, people are pushing way too hard in an isometric. And then exhale and come back down. Now let's do the same thing. I want you to now straighten your leg. From here, bend the knee again. You may actually have more motion. Move your foot into the floor. Move your foot to the inside now. So I'm turning it towards the other leg. When that foot is done moving, dorsiflex the ankle. Now draw your heel gently down into the mat and then draw it back. You're going to have one side, more than likely it's this one, that's not going to feel as comfortable. So be careful there, holding that, and then exhale, let that drop. Let's do that again. Pull in the top of the foot towards the hamstring and hold it, breathing. And exhale, let that go, rest. Again, driving the heel down gently, dorsiflex the ankle, make sure that foot is turned in, lightly feel as though you're trying to bend the knee further. So you want to feel two things, the back of the knee and the belly of the hamstring. Then as we exhale, we lower that down. I'm just going to turn around so that you can see the other side. Again, as I bend my knee, I'm starting off here. You may notice the injured side doesn't bend as far. Turn the foot out. Now dorsiflex the ankle. The knee should still be pointing straight up. Heel presses down lightly. Then we're just going to draw that heel back towards the hip, holding. Then release that down. One more time, draw the top of the foot back, squeezing the heel down and gently drawing the heel towards the hip. Good, lower it. Last time, drawing the top of the foot back again. Hold, just squeezing into the back of the knee. And if you start to feel too much hip flexion, the top of the thigh, imagine your hips sinking into the ground a little bit. And then relax. Try to relax the top of the thigh. Straighten that out, take a break. Now let's re-enter that knee flex position. Hold. Drop your foot. Turn your foot inward. Now again, it's not the hip moving, it's the foot that's moving. Now pick up your foot, draw the top of your foot towards your shin, and then feel muscles engaging both behind the inside of your knee and in the belly of that hamstring. Exhale. Remember, if you're shaking or quivering or cramping, you're doing too much. Again, pull that foot back towards the shin, gently drive the heel down. Just elicit a very, very gentle muscle contraction. Relax your hip flexors here and relax. And then last time, draw the heel in, pressing in. And I will say this, you don't have to really focus so much on the ankle motion as far as bringing that way up off the floor. Just a little bit is enough. And then exhale, release it. Now from there, bringing your knee into your chest, let's go ahead and sit up again. And now I encourage you to notice how your legs feel from a seated position. Do they feel a little more relaxed than they did before? And the real test will be when you stand up and walk around. I hope this video helped you. If you like this, make sure to like and subscribe, as well as visit us on over at Fitness Integrated Science TV that you can get in any app store. Thanks for watching, and I'll see you on the next video.